Good morning, everyone, and welcome to this advocacy launch. My name is Prince Bull, and I'll be your moderator for today's event. We're still expecting some more people to join. So whilst we expect them to join, we want to start off with the program immediately. Once again, on behalf of UNAID, IDPC and WADPN, I welcome all of you. Today we have on our agenda 4 panelists I would like to introduce to you, who will be taking us through the launch this morning. Firstly, we have Patrick Burney, who is the Regional Director for UNAID. He will be giving us a welcome remark. And secondly, we have one of the commissioners from West Africa Commission on Drug, who is also a member of the board for West Africa Drug Policy Network, Adeolu Gumbi. We also have the consultant who worked on the document herself, in the person of Dania Putin. She will also be giving a presentation on each of the explainers. And then we'll have a presentation, a case study of the document itself by civil society representative from Nigeria, Chinweke Ukireke. Please note that at the end of all of these presentations, we'll have a session for questions, comments, and to discuss possibly all of these presentations. Please note that it is not mandatory to use your video as a housekeeping issue. You would, however, advise that except if you are making a presentation, you could use your video to do that. Otherwise, we'll keep our mics muted until question time. Please note, if you want to ask questions during that session, we'll let you know when it is time for questions or discussions or comments. You could use the hand raising feature on your screen so that we'll call on you to make your presentation. However, you could still use the chat to make comments, observations, and ask your questions. So at this time, I would like to call on Mr. Patrick Burney from the Regional Director for UNAID to give a welcome remark. Thank you.
Thank you very much, Prince, and good morning, everyone. I will speak in English since this is the English session. It's a pleasure to be here, though I myself am actually on home leave at the moment. But this is an important event for us in the region, and so I'm very, very happy to be here. Dear Commissioner, partners, IDPC colleagues, friends, I'm pleased to be with you for this webinar, and it is an extremely important one. The West Africa Commission on Drugs launched a groundbreaking model law back in 2018, and civil society across the region and beyond have been engaging stakeholders since then on the need to use the model drug law effectively as a blueprint for legal and policy reform in the countries of West and Central Africa. The model drug law promotes, amongst other things, the availability of harm reduction services, as well as the decriminalization of possession of drugs for personal use, in line with well-established United Nations and UNAIDS policies and policy positions. Back in 2019, the West Africa Commission on Drugs, the West Africa Drug Policy Network, and the International Drug Policy Consortium, ICDP, organized a regional workshop in our West African region for civil society advocates to raise awareness about the model drug law and how it can be used as an advocacy tool. From this and subsequent engagements, it's become clear that these advocacy explainers we're discussing today are necessary in order to help accompany and to vulgarize, as they say in French, but to help facilitate and to spread the word about the model drug law itself. Indeed, the law is by design a very long and technical document, and which UNAIDS has supported IDPC to develop and disseminate a shorter and more accessible resource, which summarizes the key points of the model drug law. A short guide for local NGOs to explore how to use the model drug law in their work was also developed. We hope that these two new tools that we'll be talking about today will directly support and empower civil society advocates for more health and rights-based drug policies in West Africa, and in turn, strengthen the responses to HIV and AIDS amongst people who use drugs, which is a growing community of concern in our region. People who use and inject drugs are among the groups at highest risk of acquiring HIV infection, and yet they remain marginalized everywhere in the world, also in our region, and they are unable to access the necessary health and social services that we need, outside of some very unique and very forward-looking examples that we see in a few countries of our region. In 2019, the risk of acquiring HIV was 29 times higher for people who inject drugs than for other populations. And new HIV infections amongst these groups new infections amongst people worldwide declined by roughly 23% between 2010 and 2019. But there was no substantial change in incidence amongst people who inject drugs. They continue to become infected very high. Punitive drug control laws, policies, and law enforcement practices have also been shown to be among the largest obstacles to healthcare in many countries, as many of our civil society colleagues well know. A rights-based approach to drug policy can improve access to healthcare and would reduce the broad inequalities which are at the heart of the work we are to do with the new global AIDS strategy that's recently been adopted globally. And so we encourage all of you, our partners, in particular policymakers and civil society, to make good use of these two new tools in order to help advance drug policy reform and harm reduction in our West and Central Africa region. With those few words, I thank you very much for your presence. I wish you very well in your discussions. And Prince, I return the floor to you. Over.
Thank you very much, Patrick, for that presentation. We hope that at the end of the day, this document, a summary of the model drug law, will be rightly used to influence drug policy reform in West Africa that is based on human rights and public health, and also improve our HIV response. So as at this time, I would like to call on Adeolu Ogurumbi to make his presentation, who is a commissioner for the West Africa Commission on Drugs, to give us an introduction as a keynote speaker. So Adeolu, I pass this over to you.
Okay, thank you very much, Prince. And good morning, everyone. Thank you for this great opportunity to share with the participants a brief information around the model drug law. And I'm particularly glad that we can today launch the explainer. We break down in the way of just introducing the West African model drug law. On Drugs is an initiative convened by the late Kofi Annan and currently chaired by the former president of Nigeria, President Olusegun Obasanjo, who is the chair of the commission and helping to steer the affairs of the commission. The commission focuses on bringing to light evidence around drug trafficking and drug control response within West Africa and as it affects security, development, health, human rights, and peace within the region. And so it's been a strong voice and also engaging in high-level advocacy for interventions. The first document that the commission released was in 2014, titled Not Just in Transit, Drug and the State of Affairs in West Africa. This is something we may want to look up on the internet to look at that document, where we made a bold statement that West Africa has really moved beyond just a transit nation for drug trafficking, but it has also become a regional, a region where drugs are also being used and consumed as well. So there's need for appropriate policy shifts, response to drug control within the region. And while we were on advocacy efforts within the region, we met with some head of states, president, and stakeholders, and we were able to interact and discuss around the challenges around drug control in their countries and also within the region. And one of the issues that came out strongly is that a couple of the stakeholders appreciate the fact that the current effort, which is reactive and prohibitionist centered, has actually not achieved a lot of things. So there was a need to review their laws and their drug laws and response. And a question some did ask was, do we have a template to guide the work or their review and the reforms they intend to begin in their countries? And at that point, it became a challenge for the commission to work with other stakeholders, other partners, and other experts to see how we can come up with a document that provides a model response to what should be seen as an effective drug control response in the region. So this brought about the development of the model drug law, which a lot of experts, civil society organizations were involved in the drafting and making input into the document. And so we have the model drug law, which provides the model legislative provisions and commentary to support and harmonize national drug law reforms. And we also found out that there's a lot of disparities between drug laws within the region, but most of the laws are actually not having the desired effect. So with the model drug law coming into place, it was also able to reflect on the UNGAS outcome document, the ECOWAS and the AU African Union commitment. So it wasn't developed in isolation or without a reference to existing document as well, but it was pragmatic and also brought to focus what is actually the realities within the region. It also reflects on evidence of effectiveness and known best practices. And for every model provision, there was a rationale explained within the document. This document is also available online, which you can look up, but within the available time, I just want to provide a little information about this document so that by the time we go into the explainer, we have some form of background to how this document came into existence, how it was developed, and the key provisions. So when there was an initial draft, we were able to conduct a regional expert meeting in September 2017 in Accra as well, where many individuals from West Africa countries were brought together to look into the draft document and review, critique it, and also make recommendation. Of course, we had a lead drafter who is also present with us on this call, who helped to tie everything together. So there were rounds of consultation, and there were a lot of back and forth among experts to look into the document. So in terms of structure, The West African, the model drug law has 32 articles covering a wide range of topics in terms of classification of substances, the power of seizure and search, the power of arrest and detention, pre-trial detention, power and duties of the court, alternatives to custody, creation of working group, supply for medical purposes, and also reference to instrument to counter organized crime, money laundering, and corruption. And the beautiful thing about the document is also their commentary and link to international conventions, which can also guide. So looking at some of the key provisions, we look at treatment and harm reduction, which is very key. We know that the treatment need and demand within the region is high, but service provision is very low and poor. So there's need to look into this. And beyond, not just looking at drug treatment, also harm reduction is also something that is also important. There are laws that impede the implementation of harm reduction, like the paraphernalia laws and the arrest and prosecution and other things. So the model drug law gives provisions on what is needed to be done. Also, another key provision is the criminal justice system, where there's need for a reform, there's need for targeted law enforcement, and the need to protect individuals against abusive policing, and the over-reliance on the criminal justice system for drug offenses, beginning with even drug consumption and use, or what we can call low-level drug offense. It also made a provision that discourages the use of pretrial detention by the criminal justice system, because if you look at some available data, a lot of people have been arrested for drug offenses, but they are kept within the pretrial detention even for many years without being charged to court. So another key thing that we look at is the proportionality of offenses and also decriminalization. It's now becoming pretty clear, and thanks to a lot of civil society advocacy to let policymakers understand that drug use should be decriminalized. Not people who use drugs should not be criminalized, but rather provide a public health response, access, and what have you. So if we have a law that is still implementing using detention for people who use drugs as a remedy, then it's against the principle of public health response. So the model drug law made a clear statement that even though the substance might still be prohibited, but people who use drug should not be considered criminal, but be provided access to services that they require to and looking at the role the individual is playing in the drug supply chain, and let there be proportionate sentencing. Let me quickly move on to another point, which is access to medicines. We know that access to controlled medicine for pain management is a challenge in West Africa and Africa as a whole. So the model drug law made bold statements around the need to make this more accessible, especially for palliative care, for what the essential having drugs like methadone dependencies making this accessible, and also for health in pain management, and for us to, because of access to this life-saving medication, and the need for a joint effort in terms of coordination, interministerial coordination, a balance between the health system control and also the human rights players being able to work together, and law enforcement being able to work together to ensure bringing to bear the health and human rights perspective as well. So these are some of the key provisions that I can speak to within the limited time available. It's an interesting document that we can look up. Of course, it contains a lot of technical details, and that's why the explainer is also being launched. But since the release of the document, it has, it's been widely disseminated. A lot of beyond West Africa, a lot of other governments have made references to it, and they are using it to guide their reform process. So I'm happy with the steps we are taking at the moment. Thanks to everyone who has worked on the two new documents that is going to be launched.
Oh, thank you very much, Adeolu, for giving us a background to the document itself, the model drug law, and also highlighting some key provisions that we need to understand what the model drug law itself targets. I mean, from the background, we know that there was a wide range of consultation, input from experts and stakeholders, affected persons, and the good side is also the document, like you said, wasn't compiled in isolation, but was able to reference some evidence-based practices and also other documents. So we want to appreciate you for this presentation. We know the document is really technical, it's detailed and very comprehensive. I know I've also used this document in time past to engage policymakers. We know they've also found challenges with the technicalities of it and how they could adopt probably the provisions in it to harmonize that with their national laws, drug laws, and which is probably the reason why we're here today, to have an explainer to make it simpler for civil society organizations to engage policymakers when it comes to these provisions. So this will now take us to our next panelist, who is the major consultant of this document, Dania, who will also give us a presentation on both of the explainers. So Dania, please, I hand this over to you now.
Thank you so much, Prince. Good day, colleagues. Thank you so much for having me here. My name is Dania Putri. I'm a consultant based in Morocco, and I'm truly honored to be part of this important meeting, and more importantly, to have been given the chance to work on these two advocacy explainers based on the model drug law, which I truly believe is a groundbreaking document that would really and has helped, in fact, enrich drug policy advocacy in the region and beyond. Mr. Adeolu Adebi has already outlined the key elements in the model drug law, which is excellent. So I will keep my intervention brief and very much focused on the explainers. So hopefully there will be more time for discussion later on. As mentioned before, we have produced two advocacy explainers. The first one being basically a summary of the key elements of the model drug law. We can call it, the ingredients basically as to what we're going to, key ingredients, and the second explainer being the sort of like list of methods and strategies on how to use these ingredients in advocacy. So let me just immediately start with the first explainer. So as mentioned before several times, the model drug law is by nature a very technical document, which is not always easily accessible to different different ranges of audience. And so this in this first explainer, that's why we have laid out the key legislative provisions in the model drug law, basically connecting the dots, based on several core themes that are in line with the purpose of a drug law, which is to support public health. So some of the recommendations of the model drug law's commentary are also included in the explainer. But the main structure and the main themes are basically based on the key model legislative provisions as included in the model drug law. So these core themes, there are 6 core themes basically that have been included here in the first explainer. The first one is on decriminalization and alternative to punishment. And in this section, basically outlined which activities do not amount to criminal offenses. So these include activities such as the possession of drugs for personal use and the provision of harm reduction, as well as the provision of factual information regarding drugs and drug policy. And here in this section, we've also included a list of alternatives to punishment, which is also to promote the principle of proportionality, for example. So in the second section, this deals with human rights obligations, especially in relation to law enforcement practices. It has been mentioned before as well that what makes the model drug law very strong is that it includes various provisions to protect people from abusive law enforcement practices, which is why in this section we've included provisions with regard to arrests, searches, seizures, trials, sentencing, which also is linked with, for example, documents like sentencing guidelines and indicative thresholds and things like that. Thirdly, we've included the sections on the provisions for medical and scientific use of drugs. These, of course, relate to the provision of harm reduction, including drug treatment, and then access to controlled medicines. And more importantly, various provisions on how to protect and widen access while reducing barriers. And these, of course, include strategies or recommendations to move away from punitive approaches. It has, again, been mentioned before that there are certain laws or certain provisions in the drug law that are constantly being used to undermine treatment centers or harm reduction premises and things like that. And so this section specifically deals with that. And also here, the key emphasis is the purpose of the drug law itself, which is, again, to support public health. Number 4, we've on purpose included this particular section on the provisions for the non-medical use of drugs. And of course, this relates to the first section with regard to decriminalization. But we feel that it's necessary that we emphasize, the need to stop the criminalization of personal drug use, which continues to magnify health risks for people who use drugs. And here we've included, the model drug law's reference to what personal drug use actually means and how to define it, including, by the use of indicative thresholds. Number 5, this is a section concerning socioeconomic aspects of a drug law. So this concerns the considerations for socioeconomic conditions in law enforcement practices, in prosecution, in sentencing. We know for sure that poverty and also economic conditions play a large role in driving or in exacerbating one's condition in or one's involvement in the drug trade. So we've also mentioned several key provisions in the model drug law that deal with alternative sanctions, but also in in how to determine proportional sentences for certain drug-related offenses. And also, in addition, this includes the need for sustainable livelihood for farmers. And number six, we've included a section on governance and coordination mechanisms. So the model drug law talks quite a bit about the need to create working groups and commissions, for example, on alternative sanctions, on access to controlled medicines, and also on sustainable livelihoods. And in this section, we've also talked about the model drug law's legislative provision for the creation of interministerial coordination mechanism, which highlights, the coordination mechanism to evaluate drug policies based on human rights and health indicators, to involve civil society, and to facilitate participation at international levels. So that's the first explainer, which deals with the key elements of the model drug law. With regard to the second explainer, this is, as I said before, a set of methods and strategies that civil society organizations can use to better integrate the model drug law in their advocacy, and to use the model drug law to advance drug policy reform. And of course, just like the model drug law itself, this second explainer was also formulated based on extensive input and experiences from civil society colleagues in the region, and many of whom who have had extensive experiences in using the model drug law as an advocacy handbook at the national and regional level. So of course, across the world, civil society advocacy strategies and tactics and priority issues differ from one organization to another and from one context to another. But actually, the model drug law can be useful for a wide range of advocacy activities. And the first strategy that I would say is also the most obvious or the most common way of using the model drug law in this case is the model drug law can be used to help advance drug law reform. Of course, in West Africa and in other regions, some countries have different drug laws and have different contexts in which civil society organizations need to deal with. Some countries have alternative sanctions, and some have taken further steps to improve proportionality. But in general, criminalization remains the norm. And sometimes when alternative sanctions are already in place, they are still, the application is still very much limited. And in this case, punitive drug law still serves as a significant obstacle to supporting human rights and public health in general. So drug law reform is, of course, key in resolving these tensions. And the model drug law can, of course, as mentioned before, serve as a template for a new drug law. And that's why it's literally called the model drug law. And but in addition to that, the model drug law can also serve as a tool to help civil society to review and to evaluate existing drug legislations in the region, as well as it can help civil society enrich and also substantiate their own legislative proposals based on specific areas of focus. Perhaps it's specific to harm reduction, specific to the criminal justice system, or perhaps it's specific to access to medicines. So there are different ways in which the model drug law can help existing or forthcoming actions on drug law reform advocacy. And we've also included in the explainer the example of how the model drug law has helped drug law reform in process in Ghana. But of course, in addition to aiding drug law reform, the model drug law can also serve civil society in many other ways. And these are not mutually exclusive, of course. So civil society organizations can surely cooperate with one another. And in so doing, they would be using the model drug law in various contexts. So some might use the model drug law in drug law reform and actually trying to change the drug law itself, but others might use it in other settings. For example, in pushing for decarceration efforts, like what has been done in Nigeria, for example, and this can also be used by other civil society organizations in, for example, to help protect people from abusive law enforcement practices, which are actually a very, very strong element of the model drug law. In addition, the model drug law can also help civil society who are working in legal aid, for example, to advocate for judicial discretion and also to protect the human rights of prisoners, to ensure that the human rights of people in detention are respected, and generally to also shift away from punitive approaches in general by providing legal aid in their day-to-day advocacy. Moreover, the model drug law can also help advocates in pushing for better access to medicines. So the model drug law itself does not actually provide very concrete legislative provisions on how this, the provision of controlled medicines can be built, because this actually depends on each country's healthcare settings. But the model drug law does provide many legislative provisions on how to reduce barriers, and advocates can surely use these recommendations and legislative provisions, including the commentary, to help their day-to-day advocacy. For example, to counter police searches of harm reduction premises, or to protect people's continued access to drug treatment, access to opioid agonist therapy, for example. And in addition, the model drug law can also be a reference for the creation of authoritative documents that can complement the drug law, in addition to helping the process of reforming the drug law itself. So, for example, as I said before, the model drug law actually provides several key attachments, key documents, such as the indicative thresholds for personal use, sentencing guidelines, and these can actually be very useful foundations for the creation of such documents in different countries in the region. But also, other than that, what I mean with authoritative documents is that as the process of reforming a drug law is ongoing, sometimes civil society advocates can also work with, for example, with certain governmental institutions or ministries in order to produce certain guiding documents and policy documents, policy statements that could help help improve the situations of people who use drugs on the ground and people living with HIV, and to ensure that things are progressing even though the drug law still has not changed or is still in the process of changing. So finally, the model drug law can, of course, help civil society organizations working with communities as well. For example, the model drug law can actually serve as a key material that could help communities and civil society organizations improve legal awareness and rights literacy, as well as it could help colleagues to promote common standards in advocacy goals. Yeah, so basically the second explainer also includes pieces of information on key advocacy moments and opportunities, and several recommendations on how to take advantage of them. The most obvious and common strategy is, of course, to leverage these opportunities to engage with policymakers about the model drug law itself. For example, by bringing printed copies of the model drug law or its summary to help facilitate meetings and to help facilitate discussions about drug law reform. But in the explainer, we've also included other ideas where civil society can make use of meetings at the UN level to enrich their advocacy, or to improve or to extend regional exchanges, as we have seen in the West Africa region. This has happened a lot, where one country is learning from another, especially aided by the model drug law itself. And of course, other ideas in which civil society can collaborate with one another at different levels. And finally, we've also included several references to funding opportunities, and and other tips on how to connect with colleagues in the region on how to advance this work. So yeah, I think I will keep it ended there, and thank you so much for this opportunity to present this to explainers, and I'm looking forward to the discussion later. Thank you.
Thank you very much, Dania, for taking us through these twin documents. That was very, very helpful for giving us the difference between the explainer 1 and the explainer 2, and how civil society organizations in West Africa and beyond could use the explainer as an advocacy tool to put in their intervention in various areas, and at different level, national, regional, and the global level. We appreciate that, and at least we were also able to understand that the explainer 1 really focuses on key elements of the model drug law. And I also want to remind our participants, I think a link was sent to all of us where we could download these explainers. So at this point, as it was earlier on mentioned by the Commissioner from West Africa Commission on Drugs, Adeolu, and Dania herself has mentioned that these documents also reference authoritative documents, and they make references to best practices as well. We want to call on Chineke, a civil society representative, precisely the focal point for West Africa drug policy in Nigeria, to present a case study in using the model drug law itself. The model drug law has been used in various countries in West Africa with different feedbacks from all of their experiences. So, but for the purpose of this particular launch, we've decided to take on Nigeria for Chineke to present to us a case study in using the model drug law to reform Nigeria drug laws in this advocacy. So at this point, we'll call on Chineke. I'll hand over to you. Please give us a case study on your experience in using the model drug law in Nigeria. Thank you.
Yeah, thank you, Prince. Good morning, everybody. I hope people are all hearing me.
Yes, Chiduke, please go ahead.
Okay.
We can hear you.
Okay, thank you, Prince, and thank you, West Africa Drug Policy Network and its partners for this wonderful job of producing the explainer. I'm actually delighted to be here. Briefly, I want to just share our experience in West African Drug Policy Network Nigerian chapter, what we did last year using the model drug law. You know, in 2019, we had as part of the support don't punish and AFLE law and the network and the Youth Rise, we partnered together with the Administration of Criminal Justice Monitoring Committee to organize the stakeholders roundtable on drug control and criminal justice reform. And that was a very successful program in 2019. And the key takeaway from that program in 2019 was actually there is this a consensus there's need to actually reform the Nigerian drug law. You know, because that meeting there was actually a representative from key federal criminal justice policymakers and agencies. So out of that consensus, it became imperative that we need to engage further, and the opportunity to do that was was actually about using this model drug law. So when we had when the support came through the network and the OCWA for us to do a further work as kind of a building up from the 2019 efforts. So we had this program, Nigerian Drug Law Reform Advocacy Program, and which the aim was actually to promote drug law reform in Nigeria and review the NDLEA Acts and also promote the adoption and use of the model drug law. So part of the key strategy we used was we produce some copies of the model drug law and use it as an advocacy tool. We visited some key federal government criminal justice actors, the Federal Minister of Justice. We visited Federal Ministry of Justice Sector Reform Coordinating Committee, the Executive Secretary, where we presented copies of this model drug law. And we also visited the drug control body of Nigeria, like NDLEA, where we made also a presentation, concerning the law, the model drug law. And also we met with the Administration of Criminal Justice Monitoring Committee. And this is actually out of the many we shortlisted, we wanted to visit, we're able to meet these few numbers because of time and availability. But the one good thing about this visits and meetings is that it afforded us opportunity to have face-to-face interface and discussion about the model drug law. It gave us opportunity to explain further to them the the importance of having a template, a guide that will help to drive about reform, drug law reform in Nigeria. And we are very excited because every one of them accepted and appreciated the effort of the producers of the model drug law, and promised to use it as for further engagement and work towards the reform in Nigeria. And another thing we did as part of the program activity was actually to develop a briefing note on drug law reform in Nigeria, where some part of that briefing note was a kind of brief explanation about the model drug law, a kind of a summary of what the model drug law is all about. So we disseminated the briefing notes along with the model drug law, copies of the model drug law. These are the parts of we disseminated this model briefing note and also the model drug law among the key policymakers and the government actors. And the main event was actually a one-day drug law reform roundtable, which we had, that one took place the month of December, where we have all the key federal government, criminal justice, drug reform, and both civil society and state actors. We had a program, and the program was actually to discuss about the need of drug law and reform in Nigeria, and actually to make a case for the adoption of the model drug law as a template for reform in Nigeria. And it was a very, very successful event, where attended, were also disseminated among the media, and we distributed the copies of the model drug law among the participants, and even give more, especially to the Nigerian Drug Law Reform Commission. In Nigeria, we have a federal government agency under Federal Ministry of Justice that has the mandate to push forward push forward reform, law reform in Nigeria. So one of the key takeaway or result of this activity was actually we are able to engage that as an agency to the extent that the chairman of that agency came and sat through with us through that program. And she made a very big pronouncement that they are ready to work with the network to promote drug reform drug law reform in Nigeria using that template. So that was a very, very, very successful for us, because being an agency under the Federal Ministry of Justice that has the mandate to promote the law reform in Nigeria, agreeing with us, partnering with us, accepting the model drug law document as a template for them to use to push forward reform in the drug control system in Nigeria. So it was a very, very successful event. And one thing that happened is that any area couldn't attend that meeting, because that is only thing we didn't know what happened, but we suspected because they saw that we are inviting other agencies, especially the Drug Law Reform Commission, to be Nigerian Law Reform Commission to be part of our partners during the event. So the area didn't come, even where they promised during the visit and meetings they're going to be be with us during the presentation of the drug law, model drug law. And but that notwithstanding, it was a very successful event, and they were attended by the critical stakeholders and federal government agencies on criminal justice and drug law, and the civil society and other stakeholders. We part of the result of that meeting was actually we have a consensus. Almost everybody in that meeting agreed that the best thing to do is to drive and promote, advance Nigerian drug law reform using the model drug law as a template. The Law Reform Commission was very excited and grateful that there's the existing template that will guide them to push forward the reform in this area. And we agreed to further the engagement, especially with the commission, to work in partnership with them to set up what we call Nigeria Drug Law Reform Working Group to advance reform agenda in Nigeria drug law reform agenda. And that's a working group. We're going to include representatives of federal drug laws and law and justice actors, including civil society and even the media. Where because of process of fund, the funding was just to promote the model drug law. We are yet to engage further from after the program, after the event of last year. And we still have a connection and communication line with them, but we are yet to follow up that opening that the event activity of last year have brought to us, which is very, very important. And we're hoping that the network will see how we can accept fund and exploit this opportunity to work with the federal government agency that has mandate for law reform in Nigeria, that have agreed with us to promote the Nigerian drug law reform through using the template. And we are hoping that going forward, there will be some effort, more effort in this regard. That is actually what we are able to do with the model drug laws last year, and we're hoping that further we are going to advance the effort and deepen the partnership with the Commission, Nigeria Drug Law Reform Commission, who have agreed to work with us in this effort. Thank you very much. Hello?
Thank you very much. Yes, Chineke, thanks very much for your presentation. We are grateful that the model drug law was actually useful to law enforcement and drug control authorities in Nigeria. And yes, we've heard your plea. We'll seek funding so that you can follow up on your activities in Nigeria and other places in West Africa. And we hope that your next follow-up will go with the explainers, which will even make it easier for the stakeholders to shape drug laws in Nigeria. And I also want to remind all of us that the explainers have been produced in different languages. The link has been provided in the chat, just in case you want to forward the links to our friends and partners and allies to access that. And we also want to remind us that we're doing a live stream of the program, just in case you want to share that as well. And so we are moving on to a session where we'll want to entertain questions and comments, observations, and a discussion on what has been presented so far. If you want to make more inquiries on that, I would encourage you to use the hand raising feature so that I will know that you intend to make a contribution or a question to ask, and I would please make sure if you're asking the question, you direct the question to specific person so that they will address those questions. Thank you very much, Chineke. Thank you very much. Like I said earlier, the model drug law has been used right across West Africa with different feedbacks. I mean, similar feedbacks like what Chineke presented to us earlier on. And it is our expectation that with the model drug law, once we do our follow-ups with stakeholders and policymakers, it will make it even more easier for them, because the challenge has always been how do we model our national drug laws in the best way that would yield the greatest of results or impact. So we hope civil society in West Africa and even beyond West Africa will take advantage of this tool, I mean, to address several advocacy issues in their region. On the model drug law or the explainers, like I stated earlier, they're all translated into various languages, and the link is provided in the chat box. You could access the link. So I've been asked to give the floor to Pastor Bonude. Pastor Bonude, please, you have the floor. Pastor Bonude, are you still online with us? So let me look for it. So in the absence of questions and further comments, clarifications, yes, please.
Hello?
Yes, please.
Okay. Yeah, it's Chineke.
Yes, Chineke, please go ahead.
Yeah, I just want to add that I'm really pleased with the explainer, because as we all agreed that the document is the model drug law is technical in nature, so they coming into bringing the explainer added a lot of value to it, and is going to help so much in the current advocacy efforts. So I actually want to encourage most of our civil society members to use the opportunities that they presented by the explainer, and to see how we advance the advocacy work. I just hope that we will have more funding to deepen the efforts so far, in Nigeria and across the West Africa, because we know that I can remember during the reporting, one of the key challenge I presented is that limited on fund. The policy reform and law reform takes a longer time frame to be achieved, and especially when you have a strategy that is working and is effective, is need to deepen the effort and in that regard. The meetings, advocacy visitor meetings we had for the border drug law, the feedback we got from the key stakeholder policymakers, especially the NDLEA and the Law Reform Commission, we are very pleasant that we need to follow up with a very robust engagement and effort. So I'm hoping that there will be much maybe fundraising in this regard, because we have something that is very useful that can work if we put more effort and commitment in this regard. So I want to make that case. And I want to appeal with maybe USAID and who are our partner for this explainer and others to see what they can do to help the network to further and deepen the efforts ongoing, and also to look out for more opportunities to engage in countries in West Africa to using this tool. I believe we have a lot to achieve if we make a very good use of this and benefit from this model drug law. We're going to do and achieve much. Thank you.
Thank you very much, Chuneke. Thank you very, very much. Once again, I would like to appreciate UNAIDS for their support to IDPC and WADPN for putting these documents together. And I also want to use this opportunity to appeal to civil society organizations and all of those of us who are present here today to explore this document, to use this document to reach out to our policymakers, drug law enforcement authorities, to ensure that they get the benefits from this document, to push against criminalization of drug use and people who use drugs. Let's present alternatives to them. Let us push forward, our advocacy efforts to ensure that the use of drugs, the possession of drugs for personal use is decriminalized in West Africa and beyond, and to also ensure that there are alternatives. We present feasible alternatives to our governments in West Africa and beyond to incarceration for minor non-violent drug offenses. So in the absence of any hand or contributions or questions, I would like to give Daniel the opportunity, yes, again, probably to make a final statement on our presentation, whilst we try to come to the end of the session. Daniel, would you like to make a closing remark on your presentation, please?
Yes, sure, I can do that. Yeah. Thank you so much, Prince. A closing statement. I think what I would like to say at the end to close off this very important meeting is to say that the model drug law has different kinds of potential in helping civil society and policymakers in advancing drug policy. And I think in doing so, it's important and potentially very beneficial to see the model drug law or to understand the model drug law from different perspectives. And I've already mentioned in my presentation that the model drug law the main purpose of the model drug law is, of course, to assist the process of reforming a drug law. But I think it's very important that we remember that the model drug law can also help civil society advocates working in other areas and in improving the on the ground situations of people who use drugs, of communities of people living with HIV, and of various communities that are affected by drug policies. And the model drug law, of course, provides so many important and essential legislative provisions, but also other recommendations that could really help civil society to strengthen their arguments and to strengthen their engagement with policymakers, and to strengthen their proposals, be it legislative proposals of a drug law, or proposals to how to reduce arrests on a daily basis, or proposals to make sure that harm reduction centers are well protected from impromptu raids and threats like that. So so I think in sum, the model drug law has so much potential, and I'm very hopeful and optimistic that these two explainers would further strengthen the advocacy in the region. Thank you.
Thank you very much, Dania. Ladies and gentlemen, with that final word from our consultant, we would want to thank you again for joining us and for spending time with us. We hope we have made this moment very useful and helpful. And we also want to encourage all of us to disseminate this document, and also make sure whenever we can, we use it to engage our policymakers. Just in case you would have questions and comments and you want to bring to our attention, we are dropping in the chat box an email address that you could always reach us on, and we'll be grateful to respond to those concerns and comments, and also take the observations into account. Having said so, I will take this opportunity now to bring this session to an end. Once again, on behalf of UNAIDS, IDPC, and WADPN, we appreciate you and we thank you very much for spending this morning with us. Thank you very much, and have a blessed week and a great week. Thank you.